Echocardiographic examination, adjusting the basic settings for an optimal visualization. In addition to the basic choice of transducer type and frequency for the echocardiographic examination in hand, there are many other settings on an ultrasound system which need to be adjusted. Despite the efforts of the manufacturers to automate and simplify things, it is still necessary to continually adjust many of the scan and Doppler parameters during the course of an examination. The purpose of this film is to visually show how to make the fine adjustments of the basic settings during the course of the echocardiographic examination. Choosing a transducer frequency. The modern equipment allows you to choose from a range of frequencies in the same transducer. In this film, the range of frequencies for sector transducer is 1.5 to 3.6 MHz. The highest frequency, which will achieve the highest resolution consistent with adequate penetration, is normally chosen. In this clip, we demonstrate how the real-time ultrasound image will change with step-by-step reduction of the transducer frequency. The image resolution decreases and the anatomic details become rougher. However, the image's contrast is enhanced thanks to better ultrasound penetration. Now on the divided screen, you can see the direct comparison of the real-time images taken from the same patient using the highest possible and the lowest possible frequencies for this sector transducer. The optimal level of dynamic range. Dynamic range setting has a significant impact on the image characteristics. Dynamic range is usually set between 70 and 75 decibels. In this clip, we demonstrate how the real-time ultrasound image will change when one increases the dynamic range to its optimal level. Now, on the divided screen, you can see the direct comparison of the real-time images taken from the same patient at low and optimal levels of dynamic range. The time gain compensation setting. The ultrasound beam is attenuated as it is conducted through tissue. If uncorrected, attenuation will produce a scan that darkens progressively with depth. This is compensated for by the TGC, time gain compensation, amplifier, which progressively boosts the signals from deeper interfaces. This setting operates across the whole image, and so it is only possible to set the best average TGC for each examination. In this TGC setting, one will get maximal uniform boost of signals across the whole depth of the image. In the next TGC setting, one will get a low uniform boost of signals across the whole depth of the image. The third TGC setting is optimal for the majority of the echocardiographic examinations. In this clip, we demonstrate in the real-time images the correlation between different TGC settings and final images. Now, on the divided screen, you can see the direct comparison of two real-time images taken from the same patient. Note that the superficial heart structures on the upper image are too bright, but on the lower image, the in-depth enhancement of all heart structures is balanced. The overall gain setting. The overall gain setting allows us to enhance the image uniformly. One frequently changes this setting during the course of the examination. In this clip, we demonstrate how the real-time ultrasound image changes when the overall gain setting decreases. Then increases and finally when the optimal level of the overall gain setting is established. Now on the divided screen, you can see the direct comparison of two real-time images taken from the same patient, an over-enhanced image and an image with optimal level of the overall gain setting. Finally, the image with a very low level of overall gain and then with an optimal level of the overall gain setting. Changing the focus on the image. One should set the focus on the image in such a way that all structures of interest fall in the focal zone. If the focus is not set correctly, one loses the image quality. In this clip, we demonstrate how the quality of the real-time ultrasound image will improve when one shifts the focus to include the structures in the focal zone that were at first left out of it. Now on the divided screen, you can see the direct comparison of two real-time images taken from the same patient. On the upper image, the focus is not adjusted, and on the lower image, the focus is optimally set. The optimal level of compression. The compression setting can considerably impact the two-dimensional image quality. By turning the knob clockwise to increase compression or counterclockwise to decrease this parameter, one selects the optimal level of image compression. Now on the divided screen, you can see the direct comparison of two real-time images taken from the same patient. On the upper image, the compression is set too low, and on the lower image, the compression setting is optimal. You can also compare the image where the compression is set too high and the image with optimal level of this parameter. Selecting the sector angle. One can select the appropriate sector angle for the examination at hand. However, in most cases the sector angle for echocardiographic examinations is 70 to 80 degrees. Note that when one decreases the sector angle, the number of frames per second increases, and as a result, the image quality improves a little. Selecting the depth setting. One frequently changes the depth setting during the course of the examination. One selects the depth setting individually, but as a rule, the heart structures must fill up most of the sector. The zoom function. Sometimes one needs to investigate small anatomic details, and the zoom function can help in this situation. In this clip, we provide an example of using the zoom function when assessing the aortic valve from the parasternal long and short axis views. The colorized control. One can use the colorized control in order to change the color of the two-dimensional image. The choice is yours, but sometimes this can help improve the image contrast. The CINELOOP function. The ultrasound system software remembers a certain number of final frames. After one freezes the image, one can use the trackball to scroll slowly across these last frames. The CINELOOP function is used very often in echocardiography. The optimal level of overall gain during a color Doppler examination. For color Doppler examinations, the B-mode image should be set up with relatively low overall gain so that the image is a little on the dark side, as the software tends to allocate color to darker areas rather than to areas which contain echoes. Now on the divided screen, one can see the direct comparison of two real-time color Doppler images of mitral and aortic valves taken from the same patient. In the upper image, the overall gain is set too high, but in the lower image, the level of overall gain is optimal for color Doppler examination. Color gain. The color gain is set to the optimal level. This can be identified by turning up the active gain until noise or color speckle is seen in the color box, and then backing off slightly on the overall color gain. Color box. The color box size should be optimal. Large color boxes take more processing power and time, so one loses the quality of the color image. In this clip, we demonstrate the optimal color box size for aortic valve investigation. Then we demonstrate the optimal color box size for mitral valve investigation. Finally, we demonstrate the optimal color box size for simultaneous investigation of mitral and aortic valves. Color Doppler. Determining the direction of blood flow. A very good example for the illustration is the image of the aortic arch obtained from the suprasternal approach. To determine the direction of blood flow, one must look at the color scale that is situated on the right side of the screen. The color of the upper part of the scale will match the color of the blood flow that moves in the direction of the transducer. In turn, the color of the lower part of the scale will match the color of the blood flow that moves away from the transducer. By turning on the color invert function, one can change the color scale. In this particular example, after increasing the color scale limit, we also increase the pulse repetition frequency. As a result, the color mosaic or aliasing is removed. After activating the color invert function, the blood flowing towards the transducer will be blue and the blood flowing away from the transducer will be red. Color flow image of the normal aortic valve. Aliasing. Adjusting the color scale. If one reveals the color mosaic or aliasing on the color flow image of the normal aortic valve, the velocity scale should be corrected to accommodate the range of normal velocities across this valve. Color flow image of the normal aortic valve. Aliasing. Adjusting the color baseline. Another way to remove aliasing is to adjust the color baseline. In this way, one can provide a wider range of shifts on one side or the other. Thus, one increases the velocity limits in one direction, but decreases the limits in the opposite direction. Color flow image of the normal pulmonary trunk. Aliasing. Adjusting the color scale. In this clip, we demonstrate another case of aliasing in the normal pulmonary trunk. The aliasing is removed by correcting the velocity scale to accommodate the range of normal velocities in the pulmonary trunk. Color flow image of the normal pulmonary trunk. Aliasing. Adjusting the color baseline. By shifting the color baseline, one increases the velocity limits in the direction away from the transducer, but at the expense of the velocities in the opposite direction. Pulsed wave Doppler. Determining the direction of blood flow. To determine the direction of blood flow, one must look at the velocity scale. If the Doppler waveform goes in the direction of the plus mark on the scale, in this case above the baseline, the blood flow is in the direction of the transducer. The spectral inversion function allows the operator to change the orientation of the display. Now the blood flow in the direction of the transducer is presented by the Doppler waveform below the baseline. Many operators prefer to display the blood flow in the direction of the transducer with the Doppler waveform above the baseline and the blood flow in the direction away from the transducer with the Doppler waveform below the baseline. Now one assesses the blood flow in the descending aorta. The blood flow away from the transducer is presented by the Doppler waveform below the baseline, the minus mark on the scale. The spectral inversion function is turned on. Then one returns to the standard setting. The blood flow away from the transducer is presented by the Doppler waveform below the baseline. Pulsed wave Doppler, the aliasing. If the pulse repetition frequency is too low for the Doppler shift frequencies from the blood flow, aliasing will occur. As a result, one sees the wraparound of the Doppler waveform. One way of removing the aliasing is to perform the corresponding shift of the baseline. Another approach to removing the aliasing is to correct the velocity scale by increasing the pulse repetition frequency. In this clip, we demonstrate yet one more example of eliminating the aliasing by using the apical approach in the pulsed Doppler assessment of the aortic valve.